For our project, we're doing the 4 abdominals, ilius, and psoas major.
For the abdominals external obliques, the point of origin is the lower 8 ribs. The point of insertion is the abdominal aponeurosis, linea alba, iliac crest, and the pubic bone. The actions of the external obliques are to function bilaterally to flex the trunk and compress its contents. It also functions unilaterally to laterally flex the trunk and rotate the trunk to the opposite side.
Next is the internal obliques. So the point of origin is the lateral 2/3 of the inguinal ligament, the anterior 2/3 of the iliac crest intermediate line, and the thoracolumbar fascia. The point of insertion is the lower 4 ribs, the abdominal aponeurosis of the linea alba, and the crest of the pubis, as you can see in the picture. And then the action is to flex and bend the trunk. It aids forced expiration by lowering the ribs and aids in the maintenance of the intra-abdominal pressure during childbirth, defecation, etc.
The third one for the abdominals is the rectus abdominis. The point of origin is the pubic symphysis. The point of insertion is the costal cartilages 5, 6, and 7, and the xiphoid process. The action is to flex the trunk and compress the abdominal contents. Stabilization is a key function.
The transverse abdominis is located in the abdomen immediately inside of the internal oblique muscle. It is the innermost muscle of the abdomen and it arises from the inguinal ligament, iliac crest, and the inner surfaces of the lower 6 ribs from the thoracolumbar fascia. The point of insertion is aponeurosis of the posterior and anterior rectus sheath and a conjoint tendon to the pubic crest and the pectineal line. The point of origin is the costal margin, lumbar fascia, anterior 2/3 of the iliac crest, and the lateral half of the inguinal ligament. And then its action is to support the abdominal wall. It aids forced expiration and rises intra-abdominal pressure. The conjoint tendon supports the posterior wall of the inguinal canal.
Next is the hip flexors. We started with the ilius. The point of origin is the upper 2/3 of the iliac fossa of ilium, the internal lip of iliac crest, the lateral aspect of sacrum, ventral sacro ligament, and the lower portion of iliolumbar ligament. The insertion point is the lesser trochanter of femur. Its fibers are often inserted in front of those of the psoas major and extend distally over the lesser trochanter. The action of the ilius is to flex and rotate the femur externally. It's also one of the most important muscles for maintaining good body posture. When coupled with the psoas muscle, the 2 muscles constitute the body's strongest hip flexors.
The psoas muscle attaches to your vertebrae of your lumbar spine and then crosses the outer edge of each pubis. It next joins with the ilius muscle in your inguinal ligament and finally attaches to your femur. So basically your psoas muscle connects your spine to your legs. The role of the psoas major is to be able to have the ability to walk and stand up. It moves your leg back and forth when you're walking. So the point of origin is both sides of the body, your vertebrae from T12 to L4. The point of insertion is the lesser trochanter, and then the action is to flex the hip joint, rotate hip joint externally, and can be involved with adduction of the hip if it has already been adducted. And for the exercises that involve the hip flexors, you can't really work them out, so you're supposed to just stretch them, which stretching prevents or treats tightness of your psoas muscle, which places pressure on your lumbar and spinal discs and thus associates with back pain.